The advice I would give to young dentists today is be patient, learn your procedures, and become more efficient.
Just curious, I'm not sure if I asked you last time, but did you do a friends and family round? Or did you accept money from or ask for money from like advisors and that type of thing?
No, I did not do a friends and family round. I just pitched to the programs that allowed or that had pitching competitions or pitching opportunities. So, no, I have not done friends and family at all. I think that when it comes to friends and family, I feel like you got to be careful. Um, you know, so I have a hard time asking my friends to pay for this product if they don't feel like need it. So I'd rather go to the ones that do need it.
Yeah, I feel the same way. And I also feel like I'd almost have to tell everyone. I don't think I would ask my family first of all, and my like close friends I probably wouldn't ask, but like maybe like that second tier of friends where and I would literally be like, look, there's a chance you give me this $5,000 or $10,000 and it's just, you don't get it back. Startups are risky. That type of conversation.
And you don't want to have your friends affected by that money, and that it's not worth it to me.
Yeah,
So
I hear you.
I do have a contact for you that can help you your product get in front of KOLs, and the KOLs actually sells your product. You know,
That'd be
so I
awesome.
have. Yeah, her name is Dr. Namrata Your Pathway. What I'll do is afterwards, I'll just send you an email and I'll connect you to.
That's awesome.
Okay.
Appreciate that.
Yeah, she has marketplace KOLs. She connects the KOLs to the dentists to keep them from being bored.
Yeah.
How long have you been doing this?
The podcast,
Yeah.
since COVID, I started it just after COVID because that's when I wrote my book and I felt like I had a story to share. And then I was just having so many awesome conversations with dentists and, people in the industry. I was like, you know what? This could be a podcast, this 20-minute conversation, like the conversation we had a couple weeks ago. Like, it's just sharing people's stories. And, at the end, I'll ask you for advice for the young dentists. We'll talk about, your story, how you got into dentistry. We'll talk about all about your company and then how people get in touch with you. But I just find it interesting.
Yeah. No worries. Yeah, I'm happy to be here. I'm glad Karen made the introduction. I would appreciate if you could pass me on to another podcaster because I'm trying to get, my name brand out there, get Z-Loupes out there so it becomes something that people recognize.
Yeah, for sure. People are always looking for guests, for sure, and it'll just keep rolling. And then I'll keep you. And then you can always, LinkedIn. There's so many. I mean, you could just reach out to people via. I don't know if you're active on LinkedIn, but I find that's such a great way to reach out to potential guests or just people that I just want to network with.
Yeah,
Um,
I find it. I'm better at networking. I'm so used to networking, personally or physically.
yeah,
The networking when it comes to LinkedIn and those kind of things, it's a little bit more clunkier for me.
yeah, it's different for sure.
Hmm.
And then
Hmm.
like you're good, once you get them on the Zoom or whatnot, even though it's not live, that's when, you can really, it's just getting them on that first meeting is always the hard part.
Right. Exactly.
And your name's easy, right? Zina Berry.
Yeah.
Okay, awesome. All right, I think we're already recording, so we'll just jump right into it. And I already have a pre-recorded intro and outro. And then at the end, actually today, I'll probably send you the raw recordings, but it'll probably go live like 6 to 8 weeks from now, and then we'll share with you all the shareables and graphics and links and all that stuff.
Okay. All right. Did you get the graphics you were looking for? I filled out your paperwork and we sent it back.
Yeah, actually, you sent me that whole deck. So I have plenty here.
Okay, great.
Yeah. So and you're the founder of Z-Loupes. Do you want to, is there another title you want to use or just founder is good?
Yeah, founder CEO is great. I do have a minority co-founder. He's an engineer, but my idea. So but I needed an engineer to be able to help bring it to market though. So I
Yeah.
quickly partnered with him.
Nice. All right. Oh, and then if I mess up or something, I'll just say stop and re-say something. If you do this, you can do the same because it's audio, video recorded and edited. So no worries if we mess up.
Okay.
Let's just go for like 20 minutes is usually good.
Okay, sounds good.
All right.
So no one's going to see this. They're actually going to hear it, right? Or they're
Just
going to see it.
audio too. I'm sorry, video too.
Okay. All right.
Yep.
Oh, well, I'm glad I put on my little stuff then.
Yeah. Yeah, you're good. Um, all right. Hey everyone, welcome back to another episode. And today I joined Dr. Zina Berry. Zina, welcome to the show.
Thank you. I'm so happy to be here, Dr. Block. It's a pleasure.
Zina is the founder of Z-Loupes, which we chatted a couple weeks ago. It's super awesome what you're up to. You've become an entrepreneur. You're solving a problem for dental professionals, and I want to get into all that. But first, Zina, how did you even first get involved in dentistry?
As a child, I wanted to first be a newscaster. However, my mother threw me into a lot of art and creative classes, and I quickly decided I wanted to be something of an artist. And my mother told me, well, artists don't really become famous and really don't make money until after they're passed on. So that quickly became something of the past. So I knew as a child I wanted to do something in the present. So actually, dentistry found me pretty early. I went to my dentist, I think it was about 11 or 12, back during the day when you can actually go by yourself. So I took the bus. I remember getting out of school and going down. And I looked up at the dentist and I thought, I want to be a dentist. And he said, no, I think you'll be better off being a hairdresser or school teacher. And I was like, no, I'm going to be a dentist. So my 11-year-old self decided I was going to pursue that dream from that point. And I remember going back to school and doing the science projects. I remember cutting up the anatomy of teeth in like the 10th grade and, little things that actually, took me to the next step, which was the college entrance exams and taking those and being successful and really start diving into what did it really take to become a dentist. It was an idea at first. It was attractive at first, right? But then you had to put the work in to really get there. And I was like, oh, this is serious business. So I really, it just was a journey that I really enjoyed after I got into the work. Not to say it was easy because it was not, but definitely looking back on it, I'm glad that I made the decision very early on.
And where did you go to college and then dental school?
So I went to Fisk University, which is in Nashville, Tennessee. And the purpose of me going to Fisk is because Meharry Medical College School of Dentistry is right across the street. So I segued myself right on over across the street and got into the dental school. Started that process, right after my senior year. I had the opportunity to get in my junior year. They had a special program where you can skip your senior year, go into dental school, get your degree. And I saw a lot of students that didn't make it in 4 years. And I was like, guess what? I'm going to enjoy my senior year and then go into dental school. And it worked perfectly because I did get out in 4 years. And that's what I wanted. It wasn't easy. As you know, dental school is a teaching lesson of life. It's a journey.
So you actually decided this journey early on from, you said when you were 11 or 12 years old, when you were with your, childhood dentist. I actually hear that story a lot, especially for those that had braces and that was kind of their first introduction to dentistry. And you continued it all the way through. Now, after dental school, did you do a residency? Did you associate? Did you open up your own practice? What happened there?
So, I must have thought I was bold back then when I graduated from dental school because I decided that I was going to go right into private practice. So one of my classmates actually went to college with, and she actually was in the medical school becoming a radiologist from Ohio. And she had a dentist. Her dentist was retiring and leaving the practice. And so she asked me if I was interested. So I actually went home with her back to Middletown. But unfortunately, by the time we got there, the dentist that was retiring unfortunately had passed. So the surviving wife, the practice was available, and I actually bought it right out of dental school and started my journey there. It was a teaching process for sure. I didn't know exactly what I was doing, and I definitely failed that first time out because that was a lot to undertake in regards to being a new dentist coming out, being able to have the business savviness to be able to start a practice and continue it. The previous practice had some struggle problems, and those are the things that I couldn't overcome. So I had to pivot. I had to go back a step or two, and I decided to work at a community health center. And I moved to Chattanooga, Tennessee. And I did that for 3 years. And then that journey took me to Syracuse, New York, where I continued to work in public health for a couple of reasons. One, it gave me the opportunity to hone my skill as a dentist. I was known as passionately known as the extraction doctor that they like to passionately call me at the health center. And the second one, I had a lot of debt and I needed to unload that debt as much as possible. And the public health service department allowed us to do that. And then third, it taught me the people skills, how to get along with staff, taught me, leadership opportunities and patient management. And you had to learn a lot of that pretty quickly because there was always patients to see. And so you had to balance that. You had to figure out how not to burn yourself out, even though you're a young, eager dentist that's ready to do any and everything. But you also have to cut it off because you have to understand that you have to survive on the other end.
Can you go back to, you said after dental school, you went with a friend and you visited a practice. The previous dentist had passed away. What was that like? Was the practice just dormant and was it hemorrhaging patients for a long time and then you had to kind of go in and rebuild it? What was that process like?
So I'm glad you asked that. It's funny because let me go back and kind of turn the dial back of time. So one of the things I discovered right away is that there were patients being seen, and the insurance company was being charged, but the data or documentation in the chart wasn't always available. So that became concerning to me. So yes, there were struggles because of lack of documentation, um, insurance duplication of charges, the patients being upset because they were like, "Well, I wasn't seen, but my insurance company paid." So there was an uphill battle as a young dentist that I had no knowledge of how to overcome. So that's why I quickly, decided to change that because I knew those are things that I couldn't get over the angry patients. I couldn't satisfy enough of the insurance company. And I just felt like I didn't have enough tools at that point to be able to make it. So I decided to close down. And like I said, I joined public health in Chattanooga, Tennessee. And I decided to just restart my journey, basically. And I did go back into private practice, but of course, this would be after several years of doing public service so that I had the savviness as far as speed and efficiency as skills. With that, now I felt like I was in a better position to go out into private practice. And this time I was successful. So I purchased a practice in Syracuse, New York back in 1999, and I retired last year. And it was a great journey.
Now, tell me, first of all, that you really just never know what a practice is like until you get in, under the hood and become, an owner or partner. And not only did you find out that there was probably that practice was probably losing patients because of the deceased dentist, but there was a lot of things going on that you didn't agree with,
Right.
and it just shows you that you sometimes you just don't know. Even if you did your due diligence. So it's hard enough for a dentist to go into a situation that's, even great, but you went into a situation that was obviously not a pleasant one, and you got out of there. So, good for you for seeing that something wasn't right. Now, tell me about what were the pros and cons of working in like a community or a public health centers that you've had a lot of experience there. I personally have only been in the private practice setting. Tell me about, life in a community health center.
Rapid is pretty fast. They expect, so in public health, they have what's called encounters. So you get these sheets of the patients that are coming through, and they pretty much want you to do one by one procedure. And it's just the way the reimbursement process was on the other end. For me, I challenged a little bit of that because I didn't feel as though the patient should come back and have an amalgam restoration on 19, but also needs a DO on tooth number 20. So I decided if they needed quadrant dentistry, I was going to perform quadrant dentistry. However, in dental school, as you know, they teach us tooth by tooth dentistry, not necessarily quadrant dentistry. So the pattern of doing tooth by tooth dentistry really resonates very well in the public health sector. And until you can do multiple procedures, you start to recognize that you're doing a better service for the patient. You're also doing a better service for yourself because you're being more efficient in the procedures, and you're reducing the chances of the patient going into a situation where they're worse. So they have a cavity, you fix the cavity rather than becoming a root canal. So it taught me speed, it taught me efficiency, it taught me leadership abilities because I had to lead a team, I had to manage the patients. The patient base isn't always nice. And what I mean by that is that sometimes they don't understand the value of what they're getting. Secondly, they are very defensive sometimes, and you have to take the time to teach them along the way. But at the same time, you got 30 minutes to get this procedure done. So that's why it teaches you that efficiency, because you're like, Miss Jane, let me say that, I'm glad you came in today. This is what we're doing. I'm going to talk you through the procedure while I'm doing it. So I'm actually giving the injection and she's not really understanding what I'm doing, but I'm already done with that. Oh, you're numb now. So I just kind of talk it through. So doing those kind of things help build the confidence of the patient base. And then after a while, they come and want to sit to see you only. And then that's when you know you've made a difference.
And you mentioned, and congratulations that you recently retired. What happened there? Why did you choose? You seem very young. Why did you choose to retire when you did? Was it because you were? And I do want to get into this, but regarding Z-Loupes, was it because you had this second career lined up with Z-Loupes, or what was your reason for retiring?
A couple things. One, I was burnt out. I'm gonna be totally transparent with you. I think COVID did a number on me. It was very hard during the COVID time frame in upstate New York with trying to figure out when we were going to go back to work. We weren't allowed to go back and see patients. So it was very tough with that. It was tough to bring the employees back to work. The payments that they were getting was more than, what you were paying them. And it really has not really bounced back in regards of our career track in upstate New York. Hygienists are very hard to find. Dental assistants are very hard to find. So after that, it became very difficult to do the same things you did pre-COVID. So with that, I started to feel that the patient not getting the best of services because we were so far behind. I felt like you couldn't catch up. So there was a lot of anxiety, a lot of fear about, am I doing a good job with the patient? Am I really reducing their pain, or am I subjecting them to more infection by, the unknown? So that was very turbulent time. So I feel as though with that, I decided to sell to, I want to separate myself out of the process of having to be a wet finger dentist.
Now, tell me all about Z-Loupes. What are Z-Loupes? Why did you start it? Let's start with your whole second career here as an entrepreneur.
Was born because when I was practicing dentistry, the loops would always be the pain of my existence. My dental assistant and I battled this all the time. From the bad to the light to it being heavy, whatever the pain points were, I was definitely feeling the pain. And I decided a few years ago, let me see if I can do something to enhance any of the loops in order to make them better or to make them in such a way where it solved my own pain. So, with that, I started a journey to create a situation where I was going to have a lighter situation with the loops. I was going to have a different option for the battery pack. And then lastly, the COVID process taught me about infection control. I mean, as dentists, we know the importance of it, don't get me wrong. But after COVID, we really understood the fact of how we were in the first line of fire to be able to get the infection because we were in the mouth. So with that, I was like, you know what? We need to do a better job at having infection control processes around the loops that we're wearing. And up until then, we didn't have a real answer to that. And I interviewed about 60 practitioners, and they're called Maven interviews. And I did this to a program called Launch New York. And with that, I was able to talk to dentists. I was able to talk to medical doctors, orthopedists. I was able to talk to jewelers and engineers that did small product development. And one of the things that they came across that were in the medical field was that, you know, how do you clean your glasses? Where do you store them? And when we started getting into those kind of questions, they were like, yeah, you know, I wipe them down. I try my best, but, you know, sometimes it causes crack and craze. And I'm really careful with that part. And so there was no real answer to it. And we were in a compromised situation when it came to the infection control. And creating the gesture control answered this, and it solved that pain point. So now we can make sure we're not touching them. I wanted to make them lighter. They're lighter. I gave another option to the battery pack. Not only do you have a waist battery pack that you clip on to wear with a belt, you have a neck battery pack that doesn't need a belt. And it gives you the 4 to 6 hours of that power that you need. And I guess the biggest thing that I wanted practitioners to have from Z-Loupes is the battery pack lives forever. And what I mean by that, when you get our kit, you get both battery packs. So right there, that solves that problem of you not having a battery pack ready and available to go. But we have a subscription model that allows you to have a replacement battery pack in 24 months if something goes wrong. So you just send it back, we send you another one. You never have to worry about living outside of our ecosystem.
Now, in your career and with the dentist that you interviewed, did you notice a pattern of pain? Personally, I suffered from a tremendous amount of back and neck and trapezius pain on my left side. And when you're in pain, you're not happy. No one is happy, and it's hard to enjoy life and work and all the that goes along with it when you're in pain. Was that one of your reasons for starting Z-Loupes as well?
Absolutely, absolutely. So when I talked about my dental assistant, I battled with these loops all the time. She would always push them up for me because I would have a habit of when I'm working, you know, eventually I'll just want to slide them up and she's pop my hand. And then we would stop and she would adjust my loops for me. And with that, that's when it became known to me that I was really straining and doing a lot of work trying to see the object, even though the magnifiers work, but they're in a fixed position. So I'm trying to look and see and come closer to it. So yes, I experienced neck and back misalignment. And my chiropractor was like, you know, you dentists are the best patients because you all have the same problem. And the muscular problems that we suffer as dentists is true. And if you go across the United States, you'll find most dentists that are 50 years of age or older have had some kind of pain associated with wearing loops.
Yeah, I was actually in my 30s and I had a left labral tear, and I just for 10 years had pain. And because my left hand is my retracting arm, and by the end of the day, my left trap would just be killing me. And, for sure, loops help. But I made some changes too. I actually stand now. I don't sit anymore. And
Mm-hmm.
I'm sitting right now, but in my back office and in my dental office, I stand as well. And I'm just uh, very in control of the patient's head. I move them where I need them to move them, and I don't sacrifice my neck or back anymore. And just these little changes really help me And I actually don't have any more pain. And I'm also constantly stretching throughout the day, and I'm always like doing
Mhm.
some sun salutations with yoga, and it just really helps me with my neck and back. Are you finding with Z-Loupes and just in general that people can have less pain?
Yeah, what I find is, like I said, the loops are a lot lighter. Things are made in a miniature fashion, and the adjuster control doesn't have a whole lot of weight at all, and it's on the side. I find that the loops are lighter, so yes, I don't feel that pain. I feel like the neck battery pack offers that other solution, and the waist battery pack offers another solution. So yeah, I feel like we're offering some features that helps you stay in practice longer, helps you to prevent having that neck and back misalignment, keeping you safe with infection control, and also making sure that you're not contaminating any other processes, like touching the patient, maybe touching your glasses, and you're having to clean them with harsh chemicals to try to get, blood or anything else off the loops. Now you have a way of not ever touching it, so that you can be rest assured that your loops are safe and you're safe.
Now, tell me about the fact that Z-Loupes is female founded.
Yeah, so in our profession, it has been male dominant, especially when you and I went to school. However, in today's generation, it's totally flopped. It's about 60% females coming out of school as opposed to males. So that switch needed to also have a switch in the way we're making our products and our medical device. So our frames are smaller, our eyes are typically closer together, our PDs are smaller. So I wanted to build something that was fashion forward, lighter in weight, complemented the female temporals, complemented their fashion. So it was very easy to pick a particular frame that answered and addressed those fashions. And I have a beveled frame through an optometrist. So this is a different process even from the beginning. So with that likeness, I feel like that in itself gave the females a way to be able to address some of the pains that they felt. And then the deflectors, the 45-degree ergos, that is becoming very known in the industry now. But it is also the one thing that differentiates us between pain and being able to have longevity of practice. So with that, obviously I adopted that really quick. I did not develop that part as far as the 45-degree deflector ergos, but I made sure they're involved in our magnification process and keeping those lightweight. So they're a little bit smaller. That addresses the female smaller PD, the lighter frames, and then of course the neck battery pack, so we don't wear belts all the time, to put a waist battery pack. And I really did not like that wire sticking out of my lab coat, catching onto a doorknob every now and then, my battery pack go flinging across the room. I was done with those days. So I wanted to build something that addressed what females go through.
Love it. All right, let's wrap up with two final questions. Number one is, how do we find out more about what you're up to? And you can leave an email, a phone number, a website. And then number two, what advice would you give to the young dental professionals out there?
Sure. So you can find us and join our wait list. We have a wait list that's going on right now for the first 25 early adopters. You can find us at www.z-loupes.com. And that's z-loupes.com. And the advice I would give to young dentists today is be patient, learn your procedures, and become more efficient.
Love it. It's so true. When you're a young dentist, and I've talked to many, and they come out of the gates thinking that everything's going to be great when they get out of dental school and they're going to be fast and making a ton of money. And then they realize that, wait a second, I no longer have that instructor over my shoulder, and they don't have 3 hours anymore to do two fillings, and they get frustrated. So I love that idea of just be patient. I compare, your first couple of years, like being in the minor leagues, it takes a while to get better, but you will get there. You just got to keep at it.
Yeah, absolutely. And I also coach some dentists as well. And when I'm coaching them, that is the one thing I'm constantly repeating to them. You have to slow it down. You cannot go out and do everything all at once, one thing at a time. So, yeah, I feel as though that is, if they can take that one piece of advice, I think they're going to find a little less anxiety driven, and they're going to be less intimidated by the fact that they have a mountain to climb in order to get over the financial barriers that's out in front of them right now.
Love it. Dr. Zina Berry, thank you so much for joining us. Excellent episode.
Thank you, Dr. Block. I appreciate you having me on your episode.